And do you just clean them after we?
I clean them afterwards.
We reuse them.
I reuse them.
Okay.
Yeah. So that's lateral, right? So lateral, you want to grit it on the outer part. Medial is the opposite. Careful with these things, don't break them. So medial is the opposite, right?
Mm-hmm.
So you're gonna get this thing. And then the grid plate. Make sure it locks in, like I said, right there.
Got it.
And then he'll compress this way, right? And the breast is gonna stay right there. Now, when you go medial, you have to cover the other breast. So I have a little thing that I use to cover it, and I take the shit out of it to make sure that it's gonna look like they had a mastectomy on the images.
Okay.
I just go wash my hands.
So when we're doing a biopsy, they don't care about the images of the other breast at all.
No, just
Okay.
care of the one that you're doing. Now, there's been a few times I've done bilateral breast biopsies. So that means you use both. You know, we have two, right? Two of each,
Yeah.
and then you would set up. Obviously, if you're doing both, you can't go medial, both lateral.
Okay.
Yeah.
But he would compress and set up both. And you have two fiducials, so you would set up both fiducials. That's the so pretty much, you know, I would just tape the crap out of this thing. Just a lot of tape. Make sure it stays on there. That's the thing.
Okay.
We need to clean this thing. It's like full of blood and
Yeah.
shit.
Okay. All right.
And obviously, you want that little flashlight we have so you can give him light because it's going to be really dark. It's going to be hard for him to see.
Oh.
He will have to set it up. Yeah.
So is that little flashlight MRI safe?
No.
Okay, so we gotta.
It'll
Okay.
begin pulling, so I just, I used to keep it here, but can't left it over there. That's fine. And the image is going to look a little weird because this thing is concave. So, yeah, it's just going to look a little odd, but it's fine. He might complain. Every time we do a video, he complains. He's like, oh, why does it look weird? Or he'll ask me, oh, why can't you, like, put this way? But you can't.
Yeah, it doesn't work that way.
No, it doesn't work that way. It just works this way, so. It just looks different than from lateral, and you just gotta let him know. But he'll complain about it regardless.
Yeah.
Bloody.
So this cover comes off when we do the biopsies.
It doesn't have to. It depends. He'll tell you, or you'll have to ask him. So all depends on where the area of interest is, if the patient has large or small breasts.
Okay.
So if they have large breasts and the area of interest kind of like more towards the middle, then you should be fine because she has really big breasts, right? That you should be able to get to it. Now, if she has small breasts and the area of interest is closer to the chest wall, then you're not gonna want to put this pad because you want their breast as far down as possible.
Okay.
And he might instruct the patient to kind of lean forward or lean down to be able to get to it.
Okay.
There's been a few times that we can't do the biopsy because we can't access the area of interest.
Okay.
So what happens with these things, right? It needs to be within the grid.
Okay.
So right here, you can't access it. So let's say,
Oh, if it's that small of a breast.
let's say the area of interest is here,
Okay.
right? You can't access it. You can't. There's a certain amount of leeway as far as how much he can angle it,
Yeah.
the needle and the biopsy device, but it can't be that extreme. So pretty much, if the area of interest is here, we can't do it.
So
And
they'd probably go to a surgery. Just either
he
hospital.
might recommend an ultrasound guided biopsy
Oh.
or stereotactic biopsy. But the thing is, like some of this stuff doesn't show up on the ultrasound because it'll be an area of enhancement. So without the contrast, you can't determine it. So it's like one of those things that he'll have to pretty much determine what they need to do.
Yeah.
But there's been a few times that I can't do it because of that. Because
Okay.
it's too far up, close to the chest wall.
Okay.
But typically with patients that have small breasts and it's,
Or men.
the men too.
Okay.
I've done a few breast biopsies with men.
Really?
Before, yeah.
Okay, so it's the thing.
It worked out because I
Alright.
had to call a female tech to help me. It was weird. It was like, oh, okay, I guess.
That's funny. Alright.
So that's the setup for that. Any questions?
Nope. So that would all be before, obviously.
Yeah, you set this up
Um,
before.
Cool. Okay. So then the other stuff too. Yeah.
Let's get rid of this stuff. No, that's clean. Nice. Yeah, just try to keep it clean because after, the biopsy, everything's going to be bloody and you have to clean it up. And you don't want to have a bloody table for your next patient.
No.
Every now and then you'll get those patients that are very anal about cleanliness or very afraid of COVID and all that stuff.
Yeah.
It's, yeah,
Okay.
it is what it is. So, you remember the setup for the biopsy stuff? Or setting up
For the
table?
most part. Clear this one.
Yeah, so we'll clear that one. Just throw this stuff away.
Do you want the bag for that one, Maddie?
Nah,
Just throw it.
it'll be fine.
Such a hazard.
Thank you. I was thinking the same thing.
I'm very clumsy and I will end up touching my face.
Alright. So then I just go into boxes. We use the, where is it? Oh. So I follow this guideline list here. And then we get that kit thing, right?
Okay.
That one
Oh,
that's
yeah.
over there. For this part?
Yeah, no, this just set up.
Okay.
So. I can't see that. That's all right. So this is your list, pretty much, right? So you want to create a sterile work environment for the rat. So you gotta start with the sterile drapes. You gotta set one up with gloves. But for now, we'll just, So you'll have someone that'll help you. So let's say I'll have Daniela help me with some gloves. Whoever's gonna be handling this stuff
Uh-huh.
needs to have sterile gloves. So. So I had two gloves. One is for Dr. K, one is for myself, or whoever's gonna be doing this.
Okay.
So essentially, you or whoever you want to do the sterile field will hand you that stuff, open up the package, and then you will set it down with sterile gloves, right?
Mm-hmm.
It doesn't help if you have sausage fingers.
So we do like the size 7, that's all we have, or?
We
'cause
have
it says-
7.5 too. That's
Okay.
Dr. Han was 7 and Dr. Kuniyoshi is 7 also. So
Oh, okay,
just
easy.
keep it at 7. All right.
Cool
You
beans.
mind throwing that out? That one. And then I'm gonna need you to open that one up. Just
Okay.
open it and don't touch the inside, please. Okay. Lift it up a little. You're essentially setting up a sterile area. Okay. So now that's supposedly sterile. Not sterile room, but it's technically sterile. Now we're gonna open up the 4 10 ml syringes. She's gonna open them for me, and I'm gonna place them.
Okay.
So, you know, you're technically sterile, so you shouldn't be touching anything. She's gonna be passing you everything, whoever you have. You
Okay.
always need someone else to help you set up. It does help a lot.
Okay.
Set up nice. Okay, and then you'll go down the list. Okay, 10 ml syringes, scalpel. I think we're out of scalpel, so
Imagine it.
yeah. Man. Oh, there's one. Don't open
Don't
it.
open it,
Yeah,
though.
because they're on back order.
Yeah.
I'm still waiting for him to bring me more.
Let me see what it looks like though, just to make sure it's everything. Okay.
scalpel.
Perfect.
So you open it, or she'll open it up for me, and I will just place it somewhere on the table.
Okay.
And then we have the spinal needle. That's the other one. We have plenty of those. You can open that up.
Okay.
Nope. That's
No,
the
it's
right
like a
one.
really.
Is it? Oh, so it's this one, the orange one.
That's, oh. It is. There you go. That's
This?
spinal needle. They flip the thing so you can see the label. Yeah.
Alright, cool.
22 by 2.5 or something like that. So you lay that out for them, and then the 18 and the 25 gauge needle.
Okay.
That's the 18, I think. 18.
18. Yes.
Big one. And the 25 is the small one. Okay. So you lay that out for him, and then some gauze. So you just open up one gauze and have it.
The square
big
things.
4x4 gauze. Those ones.
Oh, these. Oh, okay.
Hey.
I put your lunch on the computer.
Oh, thank you, Johnny. So just put it there. And that's it. Everything else, you have it out for him. But this is essentially what he's going to use, except for the spinal needle that we don't have here. But I mean, not the spinal needle, the scalpel.
Okay.
This is essentially what he's going to use. And now I will get the other sterile drape and put it over.
Okay.
And then just leave it for him for when he's ready to do his thing.
Do I put his gloves out too?
No.
No.
He'll do that, like just like I did it. So usually I leave it out for him here or wherever he's working, whichever side you're doing, just leave it ready for him. Like
Okay.
pull this stuff out.
Oh, okay.
It's okay. It's like so. Let's move all this stuff out of the way.
Pills too, or?
Yep.
Okay.
Just put them somewhere.
It's like one of those
You
bags.
see me struggling.
It needs those little like this
Instead of
kind
offering to
bags.
help me, you just laugh at me. How dare you?
Point and laugh.
But anyway, she will open this up, and then before he comes in, you'll have this covered, so it's technically sterile, but
Still for us.
yes, sterile in a non-sterile environment. So you just leave that out for him,
Okay.
and then I typically will set up the these vials. So right now there's no epi lidocaine. There's only lidocaine, lidocaine, and then this is the bicarb. So the epinephrine with lidocaine, it's on back order, so we don't have it. So I'll pretty much lay that out with the gloves there for him. And I just missing some stuff. So these ones, for iodine swabs.
Oh yeah.
This
Okay.
to sterilize the area of interest before he actually does an incision on it. So I'll have this out for him,
Okay.
and then I don't like
Band-Aid?
Band-Aid, you don't need it. I just have that on there. Okay, so that's pretty much for him.
Okay.
Yeah, what's up, man? And then this is for the biopsy,
Okay.
right? Once he does it, and then the Band-Aid and antibiotic ointment. It's not written on there, but this is post care, like once. And then the steri strips. Lay that out for later, and also a Tegaderm to put over. So when you dress the wound, or where he did the incision, you would put the steri strips, like put the skin together, so there's not a hole on it, and then lay out the steri strips over it, and then over the steri strips you're gonna put some antibiotic ointment, and then put the Tegaderm on top so it stays intact, stays in place. And this is something that you can ask for help whenever you do the biopsy. Ask Carissa or Jacqueline. They do biopsies all the time, so they can help you with, patching her up to make sure it doesn't bleed. Because once you're done with the biopsy, he's gonna have you hold the breast, which is, for me, it's awkward, but for you, it should be fine. Right? So you'll take off all the stuff, all the fixings and all the grids, and then you'll come in and hold the breast.
Okay.
And you just want to hold it in this way. You don't want to like grab it, just hold it. So you're like pinching it, and then you're gonna get the patient off, and you're gonna want someone to help you hold it the other way, because obviously this is staying in the way, right?
Yeah.
And then have it turn over, because she's gonna be uncomfortable. The exam might take an hour of being on her stomach. So
Okay.
typically we have it turn over. Someone still holds the breast, make sure the bleeding stops, and then you patch it up. So this is pretty much for him, right? He's gonna, whichever side you're doing, that's where you want it. So if he's doing the right side, then put it over there. His gloves,
Okay. Just like on the wall, or just what do you prefer usually?
wherever you,
On that little- okay.
wherever it's easier for you to reach. So I typically put it there on that little corner,
Sounds
so
good.
that he can reach for it. And this is for the post biopsy. And then I typically set up the, depending on what size. So the size you gotta determine with him, right? Remember, there's two sizes. There's technically a petite and a standard. So the petite is the 20. No, I'm sorry. The petite is the 12, and the standard is the 20. So it'll tell you right here. So this is a 12.
Okay.
So this is considered a petite. Right here it says. And then this is the other size. A 20. We call this a standard. Make sure they're not expired. So depending on what you and Dr. K decide, depending on how deep the mass is, he'll determine which size he's gonna use.
So he'll make that call.
He'll make the call. Yeah, that's what you have to go over with him the day before to make sure which size you're gonna use, because you have two different sizes. So depending on what size of the actual biopsy device, you have to match the introducer. Right. So this is a petite.
So this is called a excision system handpiece.
Yeah, pretty much the biopsy device, and then you have to match it with the introducer. So this is the introducer. So it has to be a 12.
Oh, they have to match. Okay.
Yeah, because this is a 20.
Perfect.
So it's a different size, right? It's not gonna fit.
Okay.
So then you will get these two things, and then you will get your biopsy clip marker, post clip, and this is it. So there's two of them. This is site 1, the solid one, And if you're doing a second site, then it's site 2. It looks like a dumbbell.
Okay.
So there's 2 of them. So if you only do one site, then you just use this ones.
Okay.
And then I typically have this ready for him here,
Okay.
like that. We don't open this until he says we're gonna go through with the biopsy.
Oh, okay.
Because when you inject contrast and you send over the images and post-process them, he'll come in and take a look to see if there's any enhancement. If there's no enhancement, we're not doing the biopsy. So there's always that option.
So first we do a regular breast scan.
You only gotta do axials and sagittals,
Okay. And it's a
pre and post.
breast biopsy protocol.
Right, I have it on there. I'll show
Okay.
you. And then you'll do a subtraction. So you gotta subtract the contrast minus the non-contrast, and it'll give you a negative image. And then you gotta send that over to Dynacad.
Okay.
And then once that's done, then you will call him, and he'll come in and take a look at the images and determine whether there's enhancement or not. Because it's gonna be that specific area of enhancement that they documented beforehand.
Okay.
So if that doesn't enhance, then we won't proceed.
Okay. So I would still, for the scan of the breast biopsy, I would still set up like the biopsy with the
Yeah,
images
you
and
gotta
everything.
position the patient and
Yeah.
he'll come in
Everything
and help
with
you
the
compress the
compression.
breast. So that's gonna be all set up once you start scanning. Like the breast is gonna be small, it's gonna be compressed. It's the matter of if the area enhances or not, whether you're gonna open this up or not.
Okay.
So he'll tell you like, okay, we're gonna do the biopsy. Like after he scrolls through it for like 10 minutes. He'll tell you like, okay, we're gonna proceed. Because he's gonna take them off. Yeah. Sometimes it's not obvious. So it's gonna take a long time. And other times it's super obvious, like, oh shit, there it is. Like,
Yeah.
okay, we're gonna do it. Like, this is no big
So
deal.
it'd be a pre and then the contrast and the post.
And then you have
that's-
the subtraction.
Got it.
So then,
Okay.
we have the thing over there. Do you remember how to set
Yes.
up the machine?
I do. I remember we bring it here, we plug it
Okay.
in, we don't bring it here, like just right,
Right.
on site
Okay,
there. We don't have to
so-
do all that.
Okay,
But
cool. So yeah, this is the setup. And if we go through with the biopsy, then he'll come in, he'll put on his gloves, he'll set it up. He'll ask you for the iodine swabs to clean out the area within one of the little grids. And then he'll drop the lidocaine bicarb.
okay.
And he has syringes and needles, and you always have to help him. So if he asks you bicarb, you just pop it open, hold it up like that. He'll pop the needle in, draw up how much he needs. Same thing for the lidocaine.
Okay.
Pop it open. Just have it ready for him. Use a system, pretty much.
Can for the kit though, we have it open over there. Can I video that and you show her too? Like we have it open on the floor.
Yeah.
Oh yeah.
Okay.
And
Yeah,
then
'cause I don't think
for
you've seen that.
this, so if you don't know if you're doing a biopsy or not, is this always prepared first?
Always prepared, because
Okay.
you don't want to waste time
Waste
once
time.
the
Once
patient's on the
they're
table.
already-
But if we don't go
So-
through it, that all goes to waste.
That
kinda?
goes
Yeah.
thrown out. Yeah, just
Okay.
like right now, we're gonna throw it away. But you want to be prepared for it. I mean, the thing is, you're thinking you're doing a biopsy. So if you don't go through
Okay.
it, okay, that's fine. You have free time.
Yeah.
Because they give you 2 hours. to do
Oh,
it.
I thought it was one. Okay.
No, it's 2 hours. Because you need time to prep all this up, right?
Yeah.
So it's gonna take you at least half an hour to set the whole room up to prepare for the biopsy. Obviously, when the patient comes in, you still need to do her IV. So you have to do her IV. Once you do the IV, then you call him and tell him like, okay, well, she's ready for you pretty much, so that the patient can ask him any questions about the biopsy, and he'll answer them. And he has pretty good bedside manner, actually, Dr. Kineyoshi.
Okay.
In regards to the patient care, it's pretty good. So the other radiologist, he wouldn't come in until you actually did the contrast, set him up and everything. So the patient's laying down, he'd be like, okay, I'm Dr. Tran, I'm gonna do your biopsy. Like, patient can't move. He doesn't know who the fuck you are.
Yeah.
Right. So Dr. K actually introduces himself, Dr. Kineyoshi. I'm gonna do the biopsy.
Oh, good.
He'll explain the whole process pretty much and ask them if they have any questions. So it's pretty nice because you feel like you're doing good care for the patient.
Okay, that's good.
So that's one thing about Dr. K that I would say it's good bedside manner
Okay, good. I like that.
with the patients. All right, let's go.
Okay, so we'll look at the kit thing.
So what did you have questions about this?
We'll just to go over it on video. What they think.
Oh,
That's
well,
it
and we
for
need to
her
get the
too.
biopsy device then, so we can hook this up.
Oh, you want me to get the machine?
Yeah.
Okay.
I mean, if you want to simulate it.